Moderating the session is going to be Rochelle Charles, and Ms. Charles has an MPH from the University of North Carolina and is a graduate of the CDC Public Health Prevention Service. She's currently Director of Research Development at the Virginia Commonwealth University Institute for Women's Health. She oversees research and program development in that job. She seeks specifically to increase women's health and sex and gender difference research and have some outcomes from that research. In her role, she spearheaded innovative new projects and research development teams focused on maternal and child health issues. She has over 15 years of experience at the federal, state, and local level on numerous women's health research and program projects. And I'm going to let her introduce the rest of the panel that's going to be speaking to you. I guess that's you. I've got bios on everybody else, but I assume you know your team better than I do, right? I will. Yeah, we'll have everybody come up here eventually to sit and kind of talk.
Okay. Sorry, I was a little disoriented. I literally just walked in from the bathroom. I did not hear my bio. Well, thank you for the invitation to be here, and for the gracious introduction that I didn't quite get to hear, but but thank you. Before I start, following in the steps of yesterday, I'll share a small little personal snippet about myself and where my passion, particularly for breastfeeding. Of course, as a public health professional, and then as a mom that has successfully breastfed 2 babies, and I am one of those mothers that will probably see 3 years of nursing. So right now, I have a 2.5-year-old who has not decided that she wants to stop. So from that, I've seen the whole spectrum from the public health side of the issue of breastfeeding, and then also from a personal and community perspective, as far as having supports to continue to, with my decision to breastfeed my daughter in public settings, in my own personal home, and having those supports with the family. So I think all of those pieces are so important when we talk about the issue of breastfeeding. Today I am here to give what I like to say, kind of a holistic perspective, kind of what's going on in Richmond, Virginia around the issue of breastfeeding. And my primary role is really to give the perspective from the university. So I'm part of the Institute for Women's Health. It's one of the designated institutes within the Virginia Commonwealth University Medical Center. It is part of the School of Medicine, and within that role, we are part of the School of Medicine. However, we function very differently than the academic department. So it gives us the opportunity to be really a facilitator and a convening partner, to be very collaborative and to work across different disciplines, to be able to bring in community partners, our local and our state partners, to really work on a multitude of women's health issues. In addition to just women's health issues, we're also have a focus on sex and gender differences. So looking at building the research within an academic setting for sex and gender differences. Just a little overview. So I'm going to give us just a quick overview of IWH. We'll talk about just a quick overview of the Virginia's breastfeeding environment, a little bit more detail really about our research and our program initiatives within the Institute itself. And we'll talk more importantly about our partnerships for success, and the other panelists will actually speak really more to the details of those partnerships. And I'll finally conclude with some policy and advocacy recommendations from the perspective of a academic partner. So just a little bit about the Institute itself. Just wanted to put our mission up here. I won't go through reading all of that, but we have a driving mission. Within that mission, community engagement, research, clinical services, and education are all priority areas for us. We are guided by our strategic priorities. Again, I'm not going to take time to read through all those, but I just wanted to highlight again that research, communities, education, and healthcare are our priorities, also reflective in our mission and our strategic priorities. We're established as an approved institute by the Vcu Board of Visitors in 1999. From that period, we successfully actually competed for federal funding, and in 2003, we were received designation as a National Center of Excellence in Women's Health. That designation has actually allowed us to really serve as a leader, not only in our community, but from a national platform in the areas of women's health, both in research, education, and in clinical services. I'll speak a little bit about our Stony Point Women's Health Clinical Services Unit in another slide. We are involved in the annual Women's Health Congress, which happens in the spring. We're one of the sponsoring partners on there. We do that with the Academy of Women's Health, the Journal of Women's Health, and the Institute of Women's Health. And that happens in the spring. We have about 1,000 clinicians that attend that national conference each year. Our executive director, Dr. Susan Kornstein, is the editor-in-chief of the Journal of Women's Health. And locally, we put on a Women's Health Research Day each year on the college campus, where we try to highlight the research going on the campus, and we invite our community partners to come in to learn more about the research going on at VCU. VCU is an academic medical center. So within that, we have our medical center. It's a comprehensive medical center. One of the highlights that I will say here, I think my slides are on our rotations, but recently, this year, we became a baby-friendly hospital. So those of you who were yesterday, yes, that's. I'm very proud and pleased to say that the Institute has actively worked with our lactation consultants within the medical center for many, many years. So we were very excited to contribute materials and support to that process. And so that just recently was announced. Within the health system itself, of course, they provide the breastfeeding education classes, and they have a lactation support hotline. So when mothers are in the hospital and issues are identified before leaving, they're given those resources. Recently, we have worked on looking at a telemedicine option where we can have web consultation, and looking at the issue of using looking at coding. So how can we code and get reimbursement if we're doing the web consult? So those are additional areas that we've been working with the medical center to expand some of the educational services. And then we also have a centering pregnancy program within the medical center, and Dr. Masha will probably mention that in her presentation, and she can by far speak more than I can about the centering pregnancy program within our medical center. Finally, I'll just mention that we have the Stony Point Women's Health Center, and what's really unique about this is that Stony Point was really designed to be kind of one-stop shopping, and it's really innovative and cutting edge when you think about clinical services for women. So if they are particularly focused on providing services across the lifespan, so you can be a young woman in her 18, 20-year-old transitioning into from a pediatrician's care into your own care, to older woman experiencing menopause, bone issues, and just later life issues. All of those services can be found within the Stony Point Center. So I think in itself that's a really unique model for women's health when you talk about being able to access services and to ensure that your providers are actually communicating about your health needs. So that's what I'll say about Stony Point. So as far as the Institute itself, so I wanted to give some highlights on our research foci within the Institute. Maternal child health is definitely a priority area as far as research. We have research development groups, and one of those groups is focused on perinatal health. We also have a education committee, and within our education committee, we have a breastfeeding subcommittee. And from that subcommittee, a lot of the work around breastfeeding actually grew out of that subcommittee. Other areas that we focus on, of course, mental health, substance abuse, the sex and gender differences, and we have a really high interest and focus on community engagement, particularly CBPR, so community-based participatory research, really looking at engaging community members throughout the whole process of research. Take the opportunity to at least give you a little background about Virginia itself. So I wanted to start with the infant mortality, because infant mortality was really one of the first things that I started looking at for the state of Virginia, to really think about where are the opportunities for the Institute. So when we look at that, we're a little bit higher than the national average, and we definitely want to be lower. When you look at where we are with our CDC report card on breastfeeding, again, I won't go through all of these numbers, but just wanted to give an opportunity to show that, we're slightly higher than some of the average, than the national numbers. And so our goal is really to work on one, being under the national numbers, but more importantly, just in better better percentages for our overall communities. So I just wanted to show this as far as the numbers, and also just point out when we talk about the support indicators, of course, that's very low because we haven't had very many hospitals that are baby friendly. So we're definitely looking to see those numbers increase with this new designation. So what we're all here for, breastfeeding. I came to the Institute about 5 years ago, and just personally, within my background for public health, breastfeeding was an issue that I had worked on previously. So I started thinking, what are we doing around breastfeeding? Because quite frankly, it's an issue that an Institute for Women's Health should be tackling. When we talk about turf issues and, who's doing what in research, the Institute for Women's Health should be working in breastfeeding. So I started out with just looking across the university as far as who's doing what around breastfeeding. And there wasn't a lot of interest, I would say, early on. I will say Dr. Masho was one of the names that she'll be presenting today, but she was also one of the names that continuously came up around breastfeeding. And I am happy and pleased to say that she's also part of our executive leadership team, part of the Institute. So again, it makes sense for the Institute for Women's Health to be championing breastfeeding research and education. So some of the highlights here are significant projects that have happened within the last 3 years. We've had internal university funding through our funding called the Vcu Community Engagement, and that's for Vcu faculty and students and community partners to work on any issue within community engagement. But what I think that's really significant about this is that we now had 2 funded projects around breastfeeding. So the collaborations are there for the community partners and for the VCU researchers, and we're starting to make inroads as far as getting internal pilot funding to build the research. The very first project here, actually, Dr. Masho was involved in that, and the city of Richmond, where they looked at the barriers and facilitators for breastfeeding for African American women in Richmond. This year, I'm really excited to say that Dr. Darren has successfully competed to look at doing a strategic evaluation of the ABCs of breastfeeding, which is our community model for breastfeeding education. So that's pretty exciting. I mentioned our education committee. Our education committee actually competed for some funding from our Virginia Department of Health, and we actually conducted training, which was part of many of the presentations yesterday with our healthcare providers, specifically to get them more engaged into their role in educating women throughout the clinical experience, and not only just the providers themselves, but any auxiliary staff that would have contacts with the women. They were part of those trainings. So we went out to our health departments, to Chesterfield, to Henrico, to Richmond, and we conducted training for about a year and a half. And that training was actually facilitated by our hospital lactation consultant. So again, tying all the pieces together, we have our hospital resources and expertise there, going back into our local community health departments that are able to train and engage women at that level that are going to be coming into our healthcare facility to deliver babies. We are actually looking for additional funding to continue that training pieces now, and actually from many of the presentations on yesterday, I'm actually very excited to go back and kind of champion that, particularly with our baby-friendly designation, is that we all recognize that there's a need for training, and to be able to go back and say that at a meeting such as this, that's really one of the take-home messages, that we can continue to champion that. And we've identified some online resources that we can use, so we can really look at scaling up some of those training pieces and be able to offer it in the clinical settings, or for individuals that are working in the clinical settings. And most recently, also, we became recipients of our local March of Dimes, Baby Basics Moms Club. So I'm not for sure those that are familiar with this. This is a prenatal education model that's done in the community. Our partner is here with us, Healthy Hearts Plus 2. They're the actual community nonprofit that's working in the community to connect with the women. We served as the academic partner to be able to bring that resource to Richmond. So now we have sites in Richmond and Petersburg. Petersburg is one of the highest need areas for the for the state of Virginia. So it's a significant accomplishment to be able to establish clubs both in Richmond and in Petersburg, both serving predominantly African American high need and highest, I would say, of risk populations. Another piece I wanted to really highlight is what I've termed just creative partnering up. Again, a message from yesterday is really looking at who your partners are, and are we being creative and thinking outside of the box about who we're bringing to the table and having a conversation. Several times it's been said that breastfeeding as a standalone issue isn't going to be that sexy issue that's going to engage everyone across the board, but the reality is that when you understand breastfeeding and you understand its impact on the mom, baby, family, community, it's truly everyone's issue. So really thinking outside of the box as far as how we're partnering up, wanted to highlight one of our newer partnerships is with the Vcu School of Arts. We just started thinking creatively. So there was internal funding to support something that VCU had termed, or the School of Arts had termed, Arts Health Fellowship. So it was really for a arts faculty member who was interested in doing something with health. They didn't really restrict the dollars, and just the nature of our collaborativeness and our relationships just across the university, I was able to link with one of our partners, part of the Centering Pregnancy Program in the hospital, and link with faculty in the School of Arts. And from that, the three of us literally one weekend, back and forth emails, wrote a proposal to which eventually became termed the Healthy Baby Project. And what we did is that we paired community members, primarily new teen African American, or I shouldn't say teen, but more of young African American mothers or pregnant women with art students. And we gave them the task of coming up with an artistic depiction of what it meant to have a healthy pregnancy in your community. And from that, the idea was that we would take these, which eventually became posters, to go back into the community to do a health communications campaign, and breastfeeding was going to be one of the main topics that we want to go back into the community to do. what makes us really unique is that the messages, the images are all coming from the community. What was really interesting that came out of the project, the images that resonated within this community. So I should say that I am 37, and people often say I'm young. I don't like technology. And I always say things just simply go over my head with technology. Well, the poster that stood out was a poster about gaming. And the whole premise behind the poster was that life is a big game. Pregnancy is the hardest level. And then there was a parenting arm there. Well, and it was the actual picture of the baby was a gaming graphic, so it was a little distorted, so it wasn't, it could have been anybody's baby. And that's what I really liked about the campaign itself, because it wasn't about race, it wasn't about economics, it wasn't about whether or not you lived in the East End, the North Side, the West End, it was just about pregnancy and your baby. And so just a little snippet of that. So what we're working on now with the art student is that we're trying to push that out into the community as one of many arms to be able to push educational information out to that population. But it's all going to be about gaming. So who knew? Gaming. From that really successful partnership, our School of Arts partners actually brought us on board to participate in what's the Carnegie Hall's Lullaby Project. And for those that know about it, I see someone shaking their head. It is an absolutely amazing project where you bring in primarily teens, but pregnant mothers or pregnant moms or moms that have recently delivered, and you pair them with musicians. And when you think about it, as far as our activities with the art students, that it's a very similar model, but it's actually very different in the sense that the musicians have no experience with working in the clinical settings or working with moms. So it's about training musicians to be able to be involved in their communities and to be good listeners and to really develop their craft. But it's also about giving women another space and opportunity to be creative and to design something that they're going to give back to their babies, and that will help in their parenting. And so we're starting to build on that project, and it's going to look at stuff like attachment. We're going to look at some depression pieces. We're going to look at, of course, breastfeeding. So all of those measures are going to be tied into it, but it's from a creative perspective, because on the surface you look at it as musicians connecting with these pregnant women and designing lullabies. The lullabies themselves were anything you could think about a lullaby. It's not this project. So, it's not the mom sitting there holding my sweet baby, singing the traditional lullabies. So I had the experience of actually going to Carnegie Hall and listening to these lullabies. This is absolutely amazing, beautiful music. These are musicians from all genres. So you could have a bongo, you can have a piano, you can have a classically trained singer and a rapper, all collaborating together around one lullaby. So it's just a really unique twist on giving mothers an experience that can then tie into an issue such as breastfeeding. You engage them at that level, and these women that have participated in this project, they have been from all walks of life, and we're talking about the highest risks and women that are falling through the cracks. So women that are incarcerated, women that are in shelters, women that have been abused, women that have children in the NICU. Have participated in this project, and then so that has led to other health practices around pregnancy and around parenting. So there's opportunities there. And the very last one here is that we're gearing up this summer to work on a photo voice project with our partner, again, that's with us here with Healthy Hearts Plus, where we're going to be working with actually some of the same faculty from the School of Arts to photograph these women that are coming into our community support groups as they are nursing, and to do a photo voice campaign where we're writing their stories about their nursing experiences, and again pushing that back out to the community. So which really ties into some of the pieces as far as how we're branding breastfeeding from the community perspective, not from the larger national perspective, but within the community. So as you are identifying pictures of young women and mothers that have successfully breastfed in your community, and you can read their story, that will have an impact on others making that choice. Just wanted to mention here just the areas that we collaborate within the academic cancer. I won't give a lot of time to that, but you know, the typical departments that you would expect to see there. As I mentioned, Healthy Hearts Plus 2 is our community partner that we've been really working a lot with. I'll say about this partner, what I love about them is that they're in the community and they're working directly with these women. So sometimes you will hear nonprofits and organizations say, oh, well, we can reach these women, but it's very different when you see it on the ground. Well, this particular organization, they just do a fabulous job with recruiting the young girls and staying with the girls beyond pregnancy. So they're getting the prenatal education information, and then after pregnancy, they're getting that wraparound support services around support for breastfeeding, support for continuing their education, support for being good parents, support from a holistic perspective of staying in your community and being an active member in your community. And that's very different with some of the other models and organizations that I've worked with in the past. They are also, as I said here, they're going to be part of the collaborating partner for the Baby Basics Moms Club, and they're going to be part of the Photo Voice project. And finally, that we work with the City of Richmond, who will be presenting next, about the Mayor's Breastfeeding Commission, Dr. Masho, and some of the other lactation consultants within the health system were all part of that commission, so they contributed to that, to the work itself. The City of Richmond also has a breastfeeding ambassadors program, which grew out of that commission, and the Institute for Women's Health has been a part of that. And of course, the Richmond Healthy Start. So the Institute has been part of that grant that the city holds. So I say all of this to just to be able to show that for an academic partner, our role isn't the traditional research, go in, take what you need and come out. Because we are an institute and we're not housed within a specific department, we're not limited by the departmental challenges that you'll see in academia. We're really about convening groups of partners together and really identifying where the areas that we can share resources and collaborate, and to be able to really be the central unit for facilitating that. Particularly when we're talking about how do we work with our community partners, how do we leverage our resources, how do we manage funds when we're talking about going after grant funding. There are things that we can do within the institute that maybe our nonprofits can't do, or that our departments can't do. So that's kind of our role within the issue of breastfeeding for the City of Richmond. And then finally, from yesterday and from my work over the last 5 years, from a policy and advocacy perspective, what I really think that the key areas, as mentioned, have been the training for healthcare providers. We'll definitely continue to move on that. Integrated community-based initiatives. I'm really a big proponent for community-based initiatives, because I believe that really it starts at the community level. If you can get communities engaged and activated, then you can push to some of the macro level pieces. And at the end of the day, we live in communities. We don't live in the federal government. We live within our community. So what are you doing within your community to move the issue? Access to the community-based lactation support. In the previous presentation, we started some conversations over here about who's providing the lactation consulting and where the support is coming from at the community level. Because if I'm in my community, I'm at home, I'm having issues, am I calling my healthcare provider to be connected with the consultant, or am I aware of a lactation support service in my community that I can connect with? Being able to provide more of those type of services, I think, will be helpful in the community. Another issue that came up yesterday was culturally relevant health communication campaigns and these programs. And when we say culturally relevant, I definitely am not saying because we look the same, then the campaign will resonate with me. I think that we really have to dig deeper and to really define what culture means for each community and really design messages and interventions around the culture of that community, and to be willing to modify those campaigns based on the needs of the community, individual communities, versus kind of these blanket interventions and campaigns. And then finally, the funding piece, which is a huge piece with any projects. I think earlier some of the discussion was around, how do you sustain this without having funding? Well, the reality is that we need funding. So there are some pieces that you can definitely do without funding, as far as word of mouth and making sure that good information is out there, but funding is needed. Funding and additional research. Dr. Masho will speak more about the research itself, the needs for specific research areas, but having more funding for research and evaluation tools. As I've looked at some of our other opportunities, one of the challenges is, how we're going to evaluate this. And so there's definitely a need for additional tools to evaluate what we're doing, particularly in the community settings, and looking at other evaluation tools that can work within clinical settings. So finally, I will just leave kind of a final thought for myself, as I feel like within the Institute, we are there to help women, particularly mothers, make informed choices. I personally really like this quote because it's very true. I think sometimes we're on the fence on, how much do you encourage a woman to breastfeed, because you don't want to alienate a woman who can't breastfeed or that has significant challenges that she's not able to be successful. But for every child, I think having the opportunity to even have one or two exposure to breast milk is a better choice for that baby. And there's more and more research that's coming out of that, having access to the colostrum, having access to milk for 1, 2, 3 days of life, and what a significant impact. So I think that we just need to remember that. And the final image here is not of a happy, healthy child. And the reason why is because I think that the messaging around breastfeeding has to happen well before you have that beautiful baby. So when our mothers are getting this picture and they're saying, oh my God, what is about to happen to me? We need to start there. And even really before then, really honing in on the message of breastfeeding, prenatal care, and really just health well before a woman makes a decision to have a child. So the significance of that not being a baby is that we have to start early. So I will pass the gauntlet to Deborah Garner, who is here from the city of Richmond. She will be presenting on the Mayor's Breastfeeding Commission, and she will also be speaking about the many other initiatives going on from a city level. And we thought that this was a good starting place because particularly within this group, that the issue of breastfeeding is not isolated to one area. It's not a clinical issue. It's not an academic issue. It's a community issue. So when we start talking about the community, we need to really look at who are the decision makers in your community, where those dollars are. And so for the city of Richmond, that's going to start in our mayor's office. So I welcome Dr. Garner to come forward. And following her, we'll just go right in the order on our list. So Ms. Garner will come, and then Dr. Sabo Masho will present more on the research and the policy perspectives, and then we will finish with Dr. Botnia Darren on more specifically about the ABCs of breastfeeding model itself as a community engagement model, and some additional perspectives as far as utilizing breastfeeding, not utilizing, but integrating breastfeeding into other areas such as community wealth building and really how we view our communities. Thank you.